What could be causing the bleeding after a positive pregnancy test?
Hello, and welcome to today's video where we will be discussing possible causes of bleeding after receiving a positive pregnancy test. Bleeding during pregnancy can be concerning, but it's important to understand that it is not always a sign of something serious. In this video, we will go over some common causes of bleeding during pregnancy.
Can implantation bleeding cause bleeding after a positive pregnancy test?
Implantation bleeding is a common cause of bleeding after a positive pregnancy test. It occurs when the fertilized egg attaches itself to the wall of the uterus. This bleeding can be light and is often mistaken for a period. It typically occurs around the time of a woman's expected period and can last for a few days.
What is a cervical polyp, and can it cause bleeding during pregnancy?
A cervical polyp is a growth that can develop on the cervix, which is the entrance to the uterus. These polyps are generally harmless and can cause bleeding during pregnancy. If you have a cervical polyp, you might experience light bleeding, especially after sexual intercourse. Your healthcare provider can easily detect a cervical polyp during a routine pelvic exam.
Can a subchorionic hematoma cause bleeding during pregnancy?
A subchorionic hematoma is a blood clot that forms between the placenta and the wall of the uterus. This condition can cause bleeding during pregnancy, which might be light or heavy. While some subchorionic hematomas resolve on their own, others may require monitoring by a healthcare provider.
Can an ectopic pregnancy cause bleeding after a positive test?
An ectopic pregnancy occurs when the fertilized egg implants outside of the uterus, usually in the fallopian tube. This type of pregnancy is not viable and can be life-threatening if left untreated. Symptoms of an ectopic pregnancy can include bleeding, pain on one side of the lower abdomen, and dizziness. If you suspect you might have an ectopic pregnancy, seek immediate medical attention.
What is a miscarriage, and can it cause bleeding during pregnancy?
A miscarriage is the loss of a pregnancy during the first 20 weeks. Miscarriages can cause bleeding, which may be accompanied by cramping, lower back pain, or the passing of tissue. If you experience these symptoms, it's essential to consult your healthcare provider. In summary, there are several possible causes for bleeding after a positive pregnancy test, including implantation bleeding, cervical polyps, subchorionic hematomas, ectopic pregnancies, and miscarriages. If you experience bleeding during pregnancy, it's crucial to discuss your symptoms with your healthcare provider to ensure you receive the appropriate care and support.